Good evening, everyone. My name is Eric Eichhoff, and I serve as the Associate Director of Alumni Relations at John Carroll University. Thank you for joining us this evening for our next installment of A.C.E.S, the Alumni Continuing Education Series. A.C.E.S was established in the spring of 2013 by the Office of Alumni Relations in the spirit of lifelong learning. The program offers enrichment opportunities for alumni and friends through their expertise of members of the JCU administration, faculty, and alumni community. This year, for the first time, we've gone online, and with over 800 unique registration for this summer's series, it's safe to say our alumni have responded. And we're excited to introduce you to our presenter this evening. Today, we'll explore the political impact of COVID-19 with Colin Swearingen, Ph.D., Associate Professor of Political Science at John Carroll University. Dr. Swearingen graduated from Grove City College with a BA in Political Science in 2005. In 2010, he received his MA and later his PhD in political science from the University of Oklahoma. After completing his doctorate degree, Dr. Swearingen worked in Oklahoma City in the House of Representatives from 2010 to 2012 as a research analyst and a Geographic Information System, or GIS, coordinator for redistricting. In this position, he built a large database that helped him draw 101 state house districts, 5 congressional districts, and numerous county commissioner districts, school board districts, and career technology districts. He also worked closely with the redistricting committee chairman and subcommittee chairman to draw regional house district plans. Also in Oklahoma City, Dr. Swearingen staffed several legislative committees and fielded research questions on topics related to redistricting, wildlife, veterans affairs, international relations, and tourism. Utilizing his unique experience he acquired at Oklahoma State Capitol, Dr. Swearingen takes his experience to the classroom, where teaching courses such as political analysis, political science research methods, the American presidency, healthcare access in Latin America, among others. Within the classroom, his other areas of expertise include American politics, elections, voting behavior, Congress, public administration, public management, budgeting, and geographic information systems. In 2020, Dr. Swearingen was named the recipient of the prestigious Lucrezia Colicchio Award for Teaching Excellence in the College of Arts and Sciences. Outside the classroom, Dr. Swearingen helped run the Honduras Immersion Program, and while in Honduras with this program, he crash landed a drone. Please join me in welcoming Dr. Colin Swearingen.
Thank you, Eric, for the kind welcome, and welcome to everybody that's here. I appreciate and I'm honored to be part of the A.C.E.S program. I'm also very flattered to see the number of attendees that we have and that you're willing to spend some time with me. A special shout out to some of my former students. As I scroll through the attendees list, I recognize quite a few of the names, and it's nice to at least see that you're all staying involved with John Carroll and all of that. And to correct the record, Eric, I've now crashed 2 drones in Honduras, or the same drone twice, we'll put it that way. So there's that. The game plan today is, we have about an hour or so to talk about the politics of COVID, but I really want to spend about 15 minutes giving you a 30,000-foot overview of how I see the politics and the complexities of what's going on in terms of political pressures, and in particular, where we get a lot of tension in our political system. There's no doubt that right now we're seeing a lot of combativeness in our political system. And we definitely see that as it relates to how various states open, reopen, close down, or just deal with the overall coronavirus pandemic. So I'll spend some time talking about a couple of issues that I think are going to be very relevant for that. That said, there are a couple of issues that I really would anticipate we'll get to in the Q&A session that aren't necessarily embedded within COVID, but very much related to that. And in particular, I'm referring to the presidential election upcoming here in November, as well as some of the race-related protests that have been going on over the last 5 to 6 weeks. So I know that Eric's been thinking of some questions. I know he likes to do that and try to stump me, I'm sure. But we'll see just how much we can get through over the next hour. So the first area that I really want to spend some time talking about as it relates to COVID and the tensions that we see is this issue of executive strength, right? If you think back to American history, We know that the strength of the executive branch is something that has been debated since our very beginning. And when we think about the founding fathers and the Constitutional Convention of 1787, if you look back through the notes that James Madison compiled, we see that there's a lot of time and effort spent on what the executive is going to look like, and how we elect our executive, and how much power they should have vis-a-vis the rest of our government. And what's interesting about that is that we clearly see from those notes, from the Constitution itself, that Congress is the first branch of government, right? If you go back through the Constitution and start with Article 1, that's Congress. It's longer than Article 2, which is the executive. There are more powers talked about in Article 1 than there are in Article 2. The powers that are given to Congress above and beyond just the power of the purse are more substantive than those that are given to the president. But at the same time, what we've seen is a different type of executive now than the founding fathers set up in 1787, right? We see that, especially over the last 80 to 90 years, the growth of the executive branch in terms of its powers has increased. Now, this started really in response to the Great Depression. And that's one of those events that I think fundamentally changed the way that people in America viewed the federal government and the role of the federal government and the president in dealing with a crisis. So we've got a system of government set up where Congress is supposed to dominate, yet the presidency has seen more and more power over time. And within that, we actually do see quite a bit of conflict within our political parties, not between our political parties, but within our political parties. If we think to right now the Republican history and political thought of the conservative movement, it's not very hard to find people who advocate for a weak executive, very similar to what the founding fathers envisioned, similar to Henry Clay's view as they push back as the Whig Party against Andrew Jackson. If you go back and read some of Abraham Lincoln's early political writings and his speeches, he's very skeptical of a powerful executive. So people in the 20th century, especially in the mid-20th century, like Senator Robert Taft of Ohio or William F. Buckley, talked about a very relatively weak executive that would allow Congress to be more active in solving the problems that face the country. Now, there are some issues with this when it comes to something like a crisis, right? If Congress is in charge, then getting people to sit down together is difficult. Getting them to talk to one another, especially in today's climate, is challenging. And then getting them to pass legislation that is going to be put into effect immediately is also very difficult. If you recall the CARES Act, when it went out and we get stimulus dollars sent directly to our bank account if you've filed your taxes with the government online, well, there was still a lag between when the bill gets passed and when direct action takes place. Now, like I said, there's been a lot of conflict even within the parties, and in particular the Republican Party, as to the strength of the executive. So you have people like Robert Taft and William F. Buckley. You also have people through the Nixon administration, the Reagan, and both Bush administrations that have argued for a stronger executive. And perhaps one person that I think personifies that the most would be Dick Cheney, who was active in all those administrations and advocated for a stronger executive, arguing that that's how conservatives can get government policy the way they want it. Now, that tension really has had a couple of things, I think, add to it, or at least bolster the movement toward a strong executive, even among conservative political elected officials or political thought leaders, right? One of those would be 9/11. If you think back to almost 20 years ago, the Bush administration was kind of in a tough position dealing with the election of 2000, trying to get some significant tax reform, education reform. But once 9/11 happens, you saw a lot of Republicans who were elected that may have even gone back to the Taft and Buckley way of thought, move over toward the Dick Cheney school of thought, which is, wait, we're at war, the president is in charge, we're going to defer to what the president wants, and what the president says the president should get. Now, another thing that has helped add, I think, tension to how we deal with crises is that Congress has a hard time passing not only laws, but laws that are specific enough to tell people what needs to go on. And by people, I am referring not so much to us, but I'm referring to the administrative state, right? The people that are in the bureaucracy that are in charge of implementing and executing the laws. This would include people who are appointed officials, as well as those who are, career bureaucrats. And when Congress passes legislation these days, it's very vague. Oftentimes it's in the form of an omnibus bill, which is, a large bill that can be up to thousands of pages that deals with a lot of different issues. And basically everyone gets something out of the bill, so they have incentive to vote for it and not to vote against it. So what that means is that a vague bill means that the agencies and departments that are responsible for implementing the legislation are also tasked with defining the terms and setting up all the means testing, the measures that we're going to be using, and determining whether or not something is successful. In other words, Congress has ceded its power to be specific and given that to people that are unelected, the bureaucrats and the people that are political appointees. Well, for those of you that are familiar with, the conservative thought process, that in and of itself is problematic, right? There are a lot of Republicans, and you could argue that Trump is in many ways part of this, that are very skeptical of this administrative state, right? In some cases, people like Nixon were paranoid when it came to dealing with bureaucrats and wanted people that were loyal to them and trustworthy in the decision-making rooms. That way the bureaucrats wouldn't have as much power. So when we get to a crisis, this tension within the conservative political thought, this tension within Congress and the executive branch, and this tension with trusting the administrative state to get things done affects the decisions that people make. And in this case, President Trump, as a Republican, I think is very much affected by this, whether he's directly paying attention to these debates or not. People that are advising him do pay attention to this stuff. And so if there's a skepticism of the administrative state, it then affects the kind of people that are appointed to the bureaucracy. It affects the kind of people that are in charge of the CDC, of the FDA, of Health and Human Services, and the agencies and departments responsible for carrying out some sort of response to a pandemic. When many people appoint these officials, they're looking for loyalty and they're looking for trust. They're not always looking for expertise. They want people that when the president says to do something, these individuals will go out and do it. Now, that's not always a bad thing, but it does cause tension in the decision-making process in these organizations. And when you have something like a crisis, that can lead to some potential issues. Now, in Trump's approach, I think it's fair to characterize it as been very much hands-off. He's let the governors dictate the response to COVID by and large. They're responsible for doing things within their states. So we have the tensions that arise from powers of the executive branch and what can it do and what Congress is doing and how the two main branches work together, and even the thought process behind how strong the executive should be within the political party, in particular the Republican Party. But we also get to the second theme that I want to talk about, and that is federalism, right? This idea that we have 50 states plus territories, plus Washington, D.C., all making different decisions. So the challenge then becomes when you have a national crisis like COVID is how do we see a response that's coherent and is going to be effective when you have 50 different sets of state law, 50 different constitutions, 50 different legislatures, 50 different governors, all making decisions. Now, some of this is, of course, by design, but we've seen quite a bit of variation from some governors to the next, right? We've seen that some governors like in Ohio and New York, Pennsylvania, have taken more of an activist approach. They've been at the forefront of this. They've been on TV. They've been making decisions that are very, strong executive-based decisions. And then other governors have been kind of, again, more hands-off, laid back. And in particular, I think of, governors of Mississippi, Missouri, Governor Ducey out in Arizona. Again, 50 different states, 50 different responses. To give you a little bit of an illustration of that, in Ohio, here we hear more about that at John Carroll because we're looking to the governor for guidance as to how to deal with COVID and as an Institute of Higher Education. Ohio law clearly gives the Department of Health the power to make orders and rules to help prevent the spread of a contagious or infectious disease. This law was put on the books in 1886 to help prevent a tuberculosis outbreak or deal with a tuberculosis outbreak. But Michigan doesn't have the same laws. They don't have the same constitution. So all these governors are trying to deal with this in different ways, which provides tension, especially as you think of things like interstate commerce or people traveling from one state to the next. It wasn't too long ago where we had, the state of Florida trying to ban people from New York, and now we're seeing New York trying to ban people from Florida. These tensions arise in how we deal with COVID because of the federalist system that we have, and of course, public health is at the fore of the federalist powers when you think about it, because the 10th Amendment says, look, if it's not in the Constitution, it belongs to the states. If it's not given to Congress, it's given to the states. And at the fore of those powers are safety, health, and police powers in general. So when we have this different response, we see tension arise. We see some of the strengths of federalism. We also see some of the weaknesses of it. So we wouldn't want necessarily a national lockdown in March or April, or maybe now in June or July, which would be very difficult and constitutionally questionable at the federal level. But then the states are all doing something similar in March and April when New York, New Jersey, Connecticut dominate the new cases. And then now it's Florida, Texas, Arizona, California, and many other states seeing a rise in cases that goes beyond just the rise of testing. So when we look at this, what is, the question becomes, well, who's in charge? Is it the governors with, the 10th Amendment and, the constitutional provisions that they have within their own state and the state legislatures and the laws that they have passed? Or is it the federal government? And if it's not the federal government directly in charge, what do we expect from the federal government in its response? And if there's one thing that you hear in listening to governors or reading some of their statements is, well, they want a few things, right? One, they want guidance. They want to know, what is the protocol for how do we open? How do we close? When do we reopen? When do we reopen certain sectors of our economy versus others? They want resources. Obviously, we have a lot of unemployment going on in the country over the last couple of months. Unemployment benefits run out at the state level. They need money from the federal government. States have to balance their budgets on a regular basis. They can't take out significant loans. The federal government can. So they're looking for financial support. They're looking for block grants that help bolster education, to test for COVID, to deal with an outbreak in terms of hospital space and things like that. They're looking for knowledge. Think about the CDC and what it typically does in a pandemic, what it's trying to do here, and getting knowledge to states. What are the best practices going to be? COVID is something that we don't know a whole lot about. It's been at the fore in terms of research for the last few months, but there's a lot we don't know. We don't know how to best mitigate it, but we're looking to various agencies and organizations to help us understand how to best deal with it. They're looking for regulation requirements, and they're looking for relaxation of those regulations. If you think back to Governor DeWine asking the FDA for emergency authorization for the company Battelle to disinfect N95 masks when PPE is at a very, very low quantity here in Ohio. When we think about drugs and treatment, we also see a lot of asks of the FDA to scale back some of the regulations to allow emergency use of these authorization of certain drugs. And beyond that, governors are looking for timely decisions at the federal level. Now, again, talking about some of the tensions that arise at the federal level, it's very difficult for us to see a lot of the timely decision-making and consistent messaging coming from various branches and institutions in our federal government. Now, part of that, to kind of add even more complexity to things as it relates to who's in charge, is public opinion. We see a lot of tension right now in what people think about and how they think about COVID. In particular, if we take a look at people who are skeptical of the scientific community, by and large, we associate that with conservatives. There's some evidence that suggests that, most people, if you look at some Pew Research polling, most people want to wear masks. Most people are okay with that, but there's a sizable group of people that aren't. And these people typically are Republicans in small towns who haven't had as widespread of outbreaks, who don't have the same population density or the same volume of people moving through, that say, we want to reopen sooner rather than later. We don't really want to wear masks. We don't want to do these things. and they push back against their elected officials. In my mind, it's no surprise that we see a difference between states that are predominantly liberal and states that are predominantly conservative in how they approach COVID. Now, it's easier for someone like Larry Hogan of Maryland, who's a Republican governor of a largely Democratic state, to feed off of, what his constituents are telling him and, mandate masks or recommend masks. But for those governors who are Republicans in conservative states, they are getting a lot of pushback from people. So the pushback we get from the public and the constituents that our elected officials are listening to, and there are a lot of reasons for that, and I'm not going to go into them now, but maybe some of the questions will, right? Things like polarization are driving who gets elected, and that's going to affect who our elected officials are listening to. And it's also true in politics that those who make the most noise are the ones that people listen to. So if you get a lot of pushback about closing things down or not reopening quickly enough, there's going to be a lot of decision-making that's full of tension and combative in state legislatures and in governors' mansions as it relates to COVID. So as you can see, there's a lot of tension that goes on in the decision-making calculus in politics as it relates to COVID. Again, these tensions are things that have been around forever. The debate over executive power is not new. It's been going on for a long time. Federalism is a part of our system. It's the way that it was designed. The pros and cons of dealing with crises or even everyday problems under federalism are pretty well documented, as well as public opinion and in particular an anti-elite or anti-expert slash populist movement among the public is something that has been around forever in this country. What COVID has done is it's, I think, brought these issues to the fore in terms of how we as everyday people see the government reacting to problems and the difficulties that our elected officials have, and how muddy the waters can get when these officials have to make decisions counterbalancing public health, public opinion, constitutional powers, and those powers that are given to them by their state legislatures. Now, again, I've glossed over a lot of things. I went quickly through three things that I think are really at the fore of the politics of COVID, but there are a lot of other things related to COVID that I look forward to talking about. But right now, I think I'll turn things over to our moderators where they can go ahead and read some questions and we can get into a little bit more detail.
Great, thanks, Colin. That's a great overview of where we are right now. And I have a couple questions that we'll start with, and hopefully our attendees will share theirs in the Q&A function of Zoom. One of the ones I had was, over the years, campaigns have morphed so much from, the porch front campaigns that, local President Garfield ran for Mentor of the 1800s to more sophisticated operations using a number of methods to reach and turn out voters. Obviously, one of the most visible is the campaign rally. But also knowing that there are a lot of limitations about mass gatherings, how do you think our candidates will reach their voters this cycle in different ways if they can't have these kind of huge events that kind of fuel their campaigns?
So this right now is a huge issue for candidates. In fact, yesterday I had lunch in an outdoor patio with masks with an individual who's running for state representative here in Ohio. And I've met with a couple of people running for office, and I've asked them, what are you doing? I've talked to some campaign managers, right? And what's interesting about this is that they oftentimes say how difficult it is, especially at the low level of office, trying to get their name out there. So we have people like state representatives, county commissioners, judicial races, where people don't know who they are. Everyone knows Donald Trump and Joe Biden. Those are, 100% or near 100% name ID. But when it comes to somebody who doesn't have that same name ID, and if you think about it, state representatives, state senators, they're lucky if they have 40% name ID. I just, heard of an internal poll where an incumbent senator had like 50% name ID, and that's considered really high, and the challenger had 10% name ID. So what do you do as a candidate to go out and get your name ID? So one thing that they're doing is trying to focus on digital ads. So obviously local races, they're not going to advertise on TV. That's very cost prohibitive. It's very difficult to get your message out to just the people in your district. So they have to rely on people looking at pop-up ads on their phones. Of course, we also know that older people are more likely to vote than younger people. And I encourage all of you to go out and vote, by the way. But if older people aren't looking at their phones and they're not, looking at their computer screens as much as younger people, how do you reach them? And so I think one of the biggest challenges that we see is how do candidates fight through all the noise that is COVID, all the noise that is the race-related protests, the presidential campaign, just the overall what's going on in politics, and say, hey, remember my name. I don't think any of them have a really good answer to that at this point in time, other than digital ads and then standing by like a freeway off-ramp, just holding a sign, here's my name. Try to remember it in a couple of months. But to add complexity to that, and I'll wrap up the answer with this, is that early voting starts in like September in some states. So if you think about the amount of time you have to campaign, September and October is when you really need to get to peak name ID, especially if a lot of people vote by mail in this election.
Thank you. Our next question talks a little bit about where people get their information. So the place that people get information has a significant role on their worldview. That's, pretty understandable. Can you talk a little bit about how the information and or misinformation surrounding COVID-19 is impacting the political landscape?
Yeah, so, what's interesting in the some of the research I did preparing for this is that somewhere around the 1990s, there began to be a shift among conservatives as to whether or not they trust or have a high degree of trust in the scientific community. And so when you look at it, in the 1970s, 1980s, early 1990s, about half of conservatives and half of liberals had a high level of trust in the scientific community. When we get to the mid 2010s, that number has changed. Among liberals, it's slightly over half. Among conservatives, it's slightly over 1/3. So if people don't trust the scientific community in the time of a pandemic, and it's largely associated with conservatives, but I want to emphasize it's not limited. The trust in the scientific community among liberals is still slightly over 50%. There's a lot of them that don't trust the scientific community. So where do people get their information if they're not getting it from public health leaders or epidemiologists? Well, they get it from friends. They get it from family. A lot of people are going to get it from their community. And that can be both good and bad, right? We've seen experts get things wrong in the pandemic. We've seen them get things wrong in the economy. Heck, look at political scientists. I'll point out, I got 2016 wrong. My students love to point that out. They watch certain video clips of me on, I won't give the network, but, saying that I didn't think Trump would win the Republican nomination, right? So the experts, we get things wrong. And so it's easy for them to point to that and say, you were wrong in February, you were wrong in March, how do we trust you now? And a lot of it, I think, is difficult for people to believe what they see, what they hear, especially if it runs counter to what they're seeing. As I noted before, rural communities have not seen, by and large, the same outbreak of COVID, the same level of hospitalizations that urban areas have, with the exception of a couple communities. Think of one in Kentucky, Southwest Georgia, very rural out there. They've seen, early on a very, very large outbreak. But, when they see it differently than people in the Beltway bubble and in New York, and by the way, that's where media is predominantly located, New York, Washington, D.C., and then out in L.A. If they see things differently than those areas, then they question what they're reading and what information they're getting. So where do they get their information? Again, it's going to come down to friends, family, social media. And there has been a lot of misinformation. There has been fake news along the way, both sides of the aisle. It's incredible to see some of the things that just get posted on social media. But people are looking for something that sounds smart. And whether it's true or not, people will believe it. I mean, I've had those discussions with friends. I personally am one that says, look, I will be wearing a mask when I go out places. But I have friends who don't and don't want to. And, my goal there is just to listen to what they say and see how open they are, to possibly changing their mind, or if there's anything that I could say that change their mind. I mean, a lot of people are just kind of dig in and get entrenched in their opinions.
Thanks, Colin. The next one I have is about society, and then also it merges with a question that Mike Hardy just submitted as well. And the question is, with all that is going on within our society, COVID-19, the economy, the political the protests, and attention drawn to social justice and racial equity, what do you think? How do you think that will impact what the electorate looks like? Do you think we'll see more mail-in voting? And then Mike Hardy's question is, what are the risks? Is there really voter fraud going on within mail-in voting? And and then who does mail-in voting benefit? Is it one candidate over another?
Oh, wow. Those are all really good questions. I'll try to answer them. And Eric, if I don't get to one of them, please remind me and I'll try to get to it.
Got it.
So yeah, the question about mail-in balloting, will we see a lot? Absolutely. I think that election officials in Ohio are anticipating something like 40% mail-in ballot or absentee balloting, which is significantly higher than any election we've ever had. Some states already have a lot of early voting. Florida, for instance, is notorious for over half of its votes being cast early. And that's beyond just mail. That's showing up in person to vote early. Other states have had mail-in or some version of that for quite some time. Now, what's interesting about that is there's a lot of skepticism as it relates to what the president has said for voter fraud. Now, documented cases of voter fraud are extremely rare, even in case of mail-in balloting. But I will emphasize this: it depends on the procedures and the transparency that is set up by the state through its laws, through the state Secretary of State, through the county boards of elections. In Colorado, for instance, they allow you to not only send in your ballot via mail, they have drop-in or boxes where you can drop in your ballot. You can also vote early in person if you want to, and that system works well. Now, they've been doing it since, I believe, 2013, and they have a whole system in place where they've designed it to work well in that situation, where they also count ballots early as they receive them, and not maybe update the voting totals, but you can go online, you can see if your vote has been received, you can see all that throughout the process. You can actually show up at county boards of elections and watch them physically process those ballots. When we talk about the election in 2020, if it's predominantly going to be by mail, where most states don't have that infrastructure set up, there is a risk. Now, I don't think that voter fraud is going to be rampant. I don't think it's going to be massive, but it does pose questions for how do you administer this election if you don't have that infrastructure in place, if you don't have the funds, and you don't have the rules and requirements set up that allow people to have trust in that electoral process. So I would hope that as people increase, or we see increased mail-in balloting, that states move toward Colorado and Utah and Oregon, and not go the way of California. California's, if you've ever watched election results in California, it's like, here's what happens on election day, and then 3 weeks later, we're still not quite sure who won. And that's, I don't think, the best way to run elections either. So I think there needs to be a mechanism in place to run elections with early voting and mail-in ballots effectively. Now, a lot of research that I've seen, if you want to check out somebody, and Andrew Hall at Stanford University does a lot of research on the effects of mail-in balloting. No evidence that it affects or benefits one party over another. That said, if Republicans are skeptical of voting in person, voting by mail, they may not vote by mail, and they might not vote at all, which of course then would potentially affect the outcome of the election. Maybe, and it's a little early to tell, but maybe in Wisconsin on that primary day, like there were general election races going on, Democrats did very well. It's hard to say. There was lower Republican turnout in rural areas. So emphasize that right at this point, as far as we can tell from 10 plus years, there's really no benefit to one political party over another. But if one party rejects mail-in balloting and that's the predominant way of voting, then that could affect things. Did I get everything?
The one other part was, how do you think the electorate will look as it relates to COVID-19
Yeah.
and the unrest.
Yeah. So if you take a look at 2016, I think one of the interesting things, well, let me back up. All elections are about building a coalition. Every candidate that's running for office is trying to build a coalition that is large enough to win. At the same time, especially at the presidential level, your coalition doesn't look like the previous coalition. So for Hillary Clinton, for instance, her coalition was never going to look the same as Barack Obama's. I'm not talking about racially or in terms of socioeconomic status necessarily. That's all part of it, but just overall. And you could see this in how she campaigned. She went after suburban Southwest voters and Southeast voters in a different way than Obama did in 2012. When we looked at the results of 2016, one thing became clear, that regardless of whether there were voter ID laws in states, African-American turnout was low. So in states that they didn't have voter ID, in states that they did, turnout decreased by about the same among African-American voters, which in some ways can be explained by not having Barack Obama on the ballot. So Hillary Clinton's coalition had to be different than Obama's in order to win. Joe Biden's coalition will have to be different than Hillary Clinton's in order to win. One of the challenges that Biden had heading into this race was, how do you energize minority voters to get out to vote? Minority voters typically are less likely to vote than whites, with the exception of African Americans, about as equally likely to vote, especially in 2008 and 2012, more likely to vote, but especially among Latinos and Asian Americans, both of which are strongly Democratic. How do you get their turnout to be high? So one of the things that I'm curious to see, I don't know if I can make a prediction at this point in time, but from seeing the protests that have gone on over the last few weeks, there's an energy among African-American voters that could see a huge increase in turnout in key areas. And that's the important thing. African-American turnout increasing in places like California doesn't help Joe Biden. Increased African-American turnout in Cleveland, Detroit, Pittsburgh, Philadelphia does. So how do you translate that passion, that energy that we see with protests into getting people to the polls is going to be kind of the big thing for the Biden campaign, in addition to building that coalition as large as possible.
Great, thanks, Colin. I'm going to forego my other questions I had for you and jump right into the attendees' questions because they have some great ones. Sean Cahill asks,
Hey, Sean.
if you could talk about the data, the political side behind what data is shared, what isn't, and how that affects the political climate.
Of COVID, I'm guessing?
He doesn't mention it. He doesn't say specifically COVID, but that would be my guess.
Yeah, so one of the challenges that we have is that with 50 states doing different things and the CDC not really releasing a lot of data, we're reliant on states. And the states are doing things differently. If you go to covidtracker.com, for instance, it's a great site. I think it's run by The Atlantic. And they're basically looking, I think, every 6 hours at various state Department of Health websites to get information on the latest number of cases, hospitalizations, deaths, tests, all of that. And what we see really is some states reporting data at different times. Sometimes there's a backlog. There was an instance, I think, late last week where like Ohio was like, yeah, we didn't test anybody today. Well, we know that's not true. And then like the next day it's like, hey, we tested 30,000 people. Well, no, you didn't test 30,000 people in one day. Now, where that can make a difference is the lag time in, for instance, positives. It's how do people report the data, not just the state departments of health, but journalists. Early on, right, it's like, oh my gosh, look at all these cases. And then, now, the cases that we see now, even though we see more daily confirmed cases now, public health experts say overwhelmingly that there are fewer cases of COVID now than there was in April. But we test a lot more people. Now, again, the president will say, well, see, we're testing more people, we have more cases, but the rate of positivity has gone up over the last 3-4 weeks. So it was, below 5%. Now it's pushing 8-9%. So, it's a mixed bag, and people will cite the statistics that fit what they want you to believe. So where you get your data, where you read it, but I would encourage people, look at the data yourself. A lot of really good people are taking data and just dumping it out there in data visualizations that can help you see. Again, covidtracker.com is a good one. But they're not alone. Go to whatever state you live in, go to their Department of Health website, their COVID website. You'll find information there that you can see, and you can put things in context yourself. And that, I don't think, is all that difficult as long as you know what to look for. So yeah, I would recommend look at the data, but also look at everything that you see with an eye of skepticism in terms of the data, and try to ask yourself, is there a message behind what people are saying?
All right, our next one is from George Lewandowski, good colleague of ours.
Indeed.
He has a question about basically is President Trump's support waning? People who've been very vocal, like Lindsey Graham, Rob Portman in the past, have kind of been quieter in recent months. Is his support is waning, or?
All right, so there's a lot involved in that. I'll try to keep it short. Thanks, George, for the question. So when it comes to elections and what candidates and what elected officials say, they will be behind a candidate until they believe that sticking with that candidate gives them no chance of winning. If you take a look back, for instance, at Richard Nixon, when he was in the process of being impeached in June, July, his support among Republicans was still pretty solid. It wasn't until after the release of the tapes that the Supreme Court forced that Republicans started bailing on President Nixon. And then, of course, some of them go to the White House and say, you need to resign. Until that Supreme Court case, until that decision said you have to release the tapes, Republicans were backing him. Now, in 2016, there were moments in time where I think a lot of people thought Republicans would back off of Donald Trump, whether it was after the Democratic convention and he started going after individual speakers from the DNC, when he went after the judge in New Jersey, and of course after Access Hollywood, when that tape came out. A lot of people figured this is it. At the same time, Republican officials that were running for office could tell that their base, their supporters, were not backing off of Trump. How could they tell? The messages coming into the campaign, the volume of social media messages, all campaigns at the federal level, they're looking at this stuff. And so they're seeing that they're seeing the data that shows that support for Trump stays solid throughout that. Now, fast forward to 2020. As George commented, we've not seen some elected officials that are Republicans be as vocal in their support of the president. We know that behind the scenes, many Republican elected officials are like, I cannot stand the guy. I don't agree with him. I wish he wouldn't do this stuff. But they also know election matters. What's going to be interesting to see is how much stock do Republican elected officials and Republican candidates put in the polls and the data that they see. Right now, one of the things that I am hearing is among Republican county party chairs is the polls were wrong in 2016, they're wrong now. Now, I believe there are a variety of reasons where that is not the case. I think there's a lot of, and we can get into that later, but there's a lot of evidence that suggests that things are different now than in 2016. But if they believe that, they're not going to back off their support of Trump until the very end. Now, every single cycle, we hear a lot of people kind of spread rumors, some of which may be true, some of which may not be true, of, hey, Mitch McConnell's going to tell his Senate Republicans, just go ahead, back off of Trump, cut your losses, and, do your own campaign starting in August or September. I don't know if that's true. But what you will see is when candidates for office openly oppose the president on a variety of things, that's when they're seeing something that's going to affect their own reelection chances. Thanks,
Colin. This one's from Steve Henderson, and I think it ties nicely with what you had just said. His question was, do you think COVID-19 will affect some states more than others on the political landscape? He's particularly interested in the southern or Sun Belt states. And if you've looked at any polls, you've seen Texas is within the margin of error, Arizona and McSally, and that's a really heated Senate race. What are your thoughts? Will it have more of an impact on those areas than maybe the Northeast or some of the other regions of the United States?
That's a good question. I don't know. Okay, so my early answer, Steve, I apologize, is I don't know for sure. But what I can say is that follow Donald Trump's approval rating and you'll get a sense for where he is nationally. If his approval rating is around 40%, which I believe it is right around there right now, it's hard to convince people who don't approve of how you're doing your job to vote for you. The only way you do that is by convincing them that the other person is even worse. And there's evidence that suggests that's how Trump won in 2016. There were skeptical voters, especially among Republicans, who didn't back him in the primary, that weren't going to vote for Hillary because, well, Hillary Clinton. And she had problems, right? Donald Trump was the most unpopular, least favorable candidate to ever run for president in polling history, but he ran against the second least favorite and most, opposed candidate in his polling history. Biden's a little bit different. Now, COVID itself affecting races, it's a really good question. There are a couple ways where it could affect things. One is if the GOP kind of decides they don't want to engage, and by the GOP, I'm not so much talking about the party as in the voters in the GOP, decide we don't trust mail-in balloting and we're going to try to vote in person and maybe we get to it, maybe we don't. That affects turnout. And if your base doesn't turn out, you will have problems. One other issue that people might have with COVID is, not so much that it changes their opinion of Trump, but it solidifies their opinion of Trump, whether it's positive or negative. There are a lot of people that say, I think what Trump has done is good. I think he's handled it well. I think some of the governors have done a terrible job. And so I'm going to go out and I'm going to vote for him. And they're solidified in their support. Maybe they were wavering earlier on and they said, you know what, this clinched the deal for me. Other people are going to say, okay, he hasn't been as decisive as I want him to be. And therefore I was on the fence. I'm not going to vote for him now. But really what I think, what COVID is going to do to affect the election is that it's going to dominate the headlines from here until November and beyond, to the point where if the economy does recover, it's going to be hard for that message to get out. I think that's the thing where COVID plays a big role isn't so much, how many people love Trump that now don't love Trump or vice versa. Is the president going to get out his best message to the people while COVID is ongoing? I think that poses a big challenge.
All right. Our next one is from Terry Lewandowski. It's kind of goes back to voting and specifically here in Ohio. Do you foresee any changes happening to how people vote, and specifically absentee? She asked, how does the requirement to use mail limit or lessen the number of people who vote absentee? If the virus is raging in Ohio, my guess is a lot of people won't want to go stand in poll lines.
Right.
Will there be, things that you foresee that might happen here locally?
Yeah, so I think one of the things that Frank LaRose, who is the Ohio Secretary of State, is trying to work on is making sure that everybody gets an absentee ballot request form, all registered voters, as early as possible. I also think you're going to see increased messaging on here's what you need to do in order to vote by mail. Now, some states like California, I think, is sending a ballot to all voter or all people. I think it's all adults or something like that. Other states are sending ballots only to registered voters. They're skipping that middle step. So the key is going to be that if you want to vote and if you want to vote by mail in Ohio, you want to make sure that you are checking the Secretary of State website for those requirements. At this point, as far as I know, it is you receive the absentee ballot request form. You have to send that back in, and then you will get your absentee ballot. And at that point, your ballot has to be postmarked by Election Day in order for it to be counted. If you don't live in Ohio, definitely check your state Secretary of State website, check your county board of elections website to see what those requirements are. Obviously, in a place like Colorado or Oregon or Utah, they already send out those ballots to everybody that's registered as it is. They've got that system in place. There are many places to drop it off at. So make sure you know those guidelines and know that, especially in a state like Ohio that doesn't traditionally see 40% or more of its people vote absentee, that the election officials are going to be inundated with ballots. they're going to be swamped. Think of all of our public health experts working long shifts and getting a lack of sleep and needing, more support than what we're giving them. Well, the same thing's going to hold true with election workers in October and November. So make sure you do things as early as possible to make sure that you are getting your ballot in. And also, make sure that you follow the process all the way through the end. Check to make sure that your ballot was received. If they don't have record of receiving it, call them up. With a backlog, it could take a long time. So you want to make sure that you do it early and that you follow the process all the way to the end.
Thanks, Colin. This one's from an anonymous attendee, but I think it's a really interesting one because we already talked about how COVID's impacting it right now in our society. How do you think this will have a long-term impact on the way our public views political systems and their policymakers? Do you think this will have a long-reaching impact?
Yeah, I mean, this is a great question that, I've been wrestling. I like to wrestle with these kind of long-term questions, right? Like, so, Donald Trump, for instance, got elected in 2016. A lot of people, myself included, didn't think that he would get elected. But what does that mean for our political parties moving forward and building their coalition? What does COVID mean for how we interact publicly, how we have, campaigns, how do we have public discourse, and how do our institutions respond to something like this? What I will say is what's interesting is that I think we are going to see at least a shift in the near future. And by near future, I'm going to say 3 to 5 years of how people interact and how candidates work. For instance, candidates would love to go door to door right now. They would love to be able to knock on your door, talk to you, get your feedback, introduce themselves to you, but they know that that's probably not going to go over well, even in a state that would allow that. Right? For instance, you could do that in Ohio. If you want to go door to door, you can. But think about it from the optics perspective. You're a candidate. You're wearing a mask. Does that person have COVID? Does that candidate have COVID? Why are they knocking on the door? If they're wearing gloves, why are they wearing gloves if they don't have COVID? And, there's all these things that are fraught with trying to be engaged as elected officials with voters in the way that elected officials like to do that. Town hall meetings. So I think one thing that it changes is the necessity for people to make sure that they are holding public elected officials accountable. They're getting information from them. They're asking them tough questions in a way that is still going to be transmissible to a lot of people. I don't think Zoom sessions are the best way of doing that, to be honest. I think, candidates don't like it. I don't think the public likes it. So how does that change? How do they get through that? Trust in institutions is another big one. Right now, if there's the one institution that people almost universally regard as doing a terrible job as it relates to COVID, is the media. Doesn't matter if you're left or right, criticism of the media has been absolutely just incredible. Respect for institutions like the FDA, the CDC, those remain really high. So I think there is overall this deference to people who are trying to figure some of this stuff out. But one of the things that public health experts have to make sure they do is that they're clear about what it is they mean when they say something. I'll give you an example. Dr. Fauci, right? Everyone knows who he is now, right? He's kind of a household name. Well, in February and March or January, you take a look at some of his comments, and if you pull them out, it's very clear that, wow, what he said then was completely wrong. But then when you read the entire paragraph, it's, look, we don't know. At this point, we think it's this, but it could be that. But people focus on right now, it's no worse than the flu. But we don't know is kind of the scientific way of saying it. But as a scientist, right, scientists and political scientists especially are really bad at communicating to the public. We like to couch everything we say in these, nuanced terms, and people don't really have the appetite for that. They want something a little bit more declarative. So I think our institutions, our public health institutions, and our elected officials need to understand, on one side, make sure you're clear about what you're saying. And then on the elected official side, don't just pick out what you want to hear and repeat that, but be fair to what the experts are saying, because they're trying to communicate a lot of uncertainty right now. And so my hope is that moving forward that our public health experts actually do a better job of communicating, and that they're consistent in their message, right? Are protests good or bad? One of the worst things I've seen over the last couple of months is they're good if you're doing it for social justice purposes, but not good if you're doing it for, perceived government overreach. I mean, that can't be the message coming out from public health experts. It can't, if you want to maintain that trust. So I think we have to be consistent in those messages. We have to be open with people, and I'm a big fan of, and people will disagree with this, I'm a big fan of transparency at all levels. I know sometimes letting sunshine in is messy and opens the door to people seeing what goes on. I think that's a good thing. Not everybody agrees with me.
Thanks, Colin. Rosanna Violi-Holzel has a question about social safety nets. So can you touch upon how your thoughts of how COVID-19 will affect the national conversation on things like healthcare coverage, social safety nets, as we head into the election?
Yeah, I mean, I think what's interesting is that we've seen the party of, reduced deficits. And of course, there's a lot of people that argue that the Republican Party doesn't really believe that unless the Democrats in the White House. Passing trillions of dollars worth of stimulus packages, larger than the economic stimulus packages back in 2009, right? I think it does change the discourse. I think one of the things that we're going to have to do is, once COVID generally resolves itself, whether it's through vaccine or temporary vaccines or antibody treatments or various medications, is to figure out how do we set up our healthcare system to increase capacity for when things like this happens. Now, front and center of this is not only urban areas, but working in Oklahoma for 3 years, rural public health was a terrible, terrible place. There were very few doctors in rural parts of Oklahoma, and there are very few doctors in rural parts of Ohio, and you name the state. Very few hospitals, lack of access to medications. I mean, I do medical brigades down in Honduras. I'm not a real doctor. You can talk to George Lewandowski. He's the real doctor that works on those. But the reality is, right, we do these things in Honduras. There are people that are doing these pop-up free mobile clinics in the United States, right? So these are questions that we have to address at some point. Now, healthcare has been a huge issue over the last 10 to 12 years in particular because of PPACA, otherwise known as Obamacare, and the Republican reaction to it. What's interesting is that over time, the public opinion has shifted, right? They were opposed to Obamacare. They penalized Democrats in 2010. But now that they kind of know it, now that the insurance companies know it, right, the more certain option is what we have now. I think if you try to make large structural changes, you're going to have to pay a political cost. To give you kind of an illustration of that, a friend of mine was working on Capitol Hill in 2009. We went to graduate school together. He called me up one day and he said, look, I'm working on I forget which committee it was, but it was one of the committees dealing with Obamacare. And he said, the staffers on this committee understand that as we work on this, this could throw the House to the Republicans after 2010. And if you know how DC works, right, if the House changes hands, the committee staff shifts, where if Democrats are in control, you have majority Democrats on committee staff. The Democrats hire the majority of the staff. Well, if Republicans are in control, they hire a majority of the staff. These people were working understanding that they're probably going to lose their jobs if Obamacare gets passed. Democratic members of Congress said, we're going to go ahead and vote for it. And a lot of them paid the price in terms of the election. So I think if you're going to move from what we have now, regardless of who wins the White House, to something that is fundamentally different, whether it's liberal or conservative, that party is going to probably pay a price at the polls in the following election. Now, that means, though, if they make those changes, we've had that discussion. My hope is that as we have that discussion, whichever way it goes, and I'll leave my personal opinions aside, whichever way it goes, I hope that it is an open, transparent process, unlike, by and large, what we saw in 2009, and certainly unlike what we saw in 2017.
So a quick follow-up to that. I know that the Republicans have been trying to repeal and replace Obamacare for quite some time. I think they even tried to do it during the pandemic. Is that surprising to you that they would try to do something with medical coverage while there's a national health emergency going on?
No, it doesn't. I think keep in mind that right now, a lot of the bills that are being passed by the House or bills being passed by the Senate is done with the understanding that it's not going to go anywhere, right? So the Democrats, right, they passed I think it was a $3.5 trillion stimulus package out of the House. They could put whatever they wanted to in that. And I guarantee you that there are a lot of Democrats that voted for that bill that are like, I don't want that thing to go through. Similarly, if you think to, I think 2015, when Republicans took control of the Senate, right, they went ahead, the House and Senate passed under reconciliation, defunding Obamacare. They knew that President Obama was going to veto it. And many of them, if you ask them, they were like, I don't really want this to become law, but I want to keep my promise to my constituents. That's what our elected officials are doing a lot of right now. So when Republicans propose to do various things to Obamacare and to make changes recently, they do it with the understanding that they're trying to send some sort of signal to their base, to their constituents, knowing that it's not going to go anywhere in the House. It's political posturing. That's neither good nor bad, depending on your point of view. I mean, like, it's going to happen. Elected officials are looking toward their bases to make sure that they're sending various signals to them. But I think they understand nothing's happening with that.
Okay. Olivia Shackleton asks about the recent Supreme Court ruling on the faithless elector.
Yeah.
What are your thoughts, and do you think we'll see an impact in November based off of that decision?
Hey, Olivia, good to know that you're on board here. So it was a unanimous decision, which I was kind of expecting. I mean, I'm not a huge, and Olivia will tell you this, I'm not a huge, follower of the courts. But from reading some of the stuff about the case, I'm like, okay, this probably is going to be unanimous, and it was. I was actually right about something. What does it mean? Well, if you look at the decision, my understanding of it, and again, I think there are probably some people, namely those that were the plaintiffs, probably disagree with me, but a lot of it was trying to move our system away from the Electoral College, and they viewed it as one step of doing that. Like, if we can sow some sort of discord among, the Electoral College and how it works, then people say, look, this is just bizarre. This is crazy. Let's go to popular vote. And the Supreme Court was basically like, no, you can't do this. Now, what the Supreme Court, as far as I can tell, said is, look, states have that authority to set up and restrict electors from being faithless. But it, again, emphasizes the role that the states have in playing. And there is a movement among a variety of states to pass legislation, sign it into law that says the winner of the popular vote gets our electoral votes. Numerous states have passed this legislation, not 270 electoral votes worth, but that number has grown. I think it's kind of stalled out over the last couple of years, but something to keep an eye out for, especially if you see, a more progressive Democrat get in the White House. They're going to be looking at various proposals to try to say, how do we change the Electoral College, whether it's through a constitutional amendment or going this route of letting states make that determination. I don't think the Supreme Court case really affects things for November, but it's always kind of the long-term strategic play.
Great. We'll do a couple more quick ones. Fred Montague asks in the chat box, what is the reliability of surveys nowadays, especially as more and more people are using mobile phones and less landlines are tied to a fixed location?
So I read an article in April, I think it was, maybe late March, that was saying this is the golden age of polling because everybody's at home during COVID with nothing to do and nobody to talk to. And so they're picking up their phones and they're finally answering questions from public opinion surveys. But this is a really good question because the trend has been significantly downward in people answering their phones. I worked in polling research in 2006 to 2008 in Oklahoma. Let me be honest, it was hard to get people to answer the phone. And when they answered the phone, they didn't want to take your survey. Response rates were somewhere around 8 to 10%. Nowadays, response rates are even lower. They're in the ballpark of like 3 to 5%, in some cases 1%. So absolutely, Fred, great question, because if you're getting 1% of the people, there's a good chance you're introducing bias into your poll. We know that certain people are more likely to answer their phone than others. We know that some people are more likely to take a survey than others. So what surveyors have to do is account for that somehow. Now, what the best pollsters will do is a combination, of course, of landlines and cell phones, but you're also seeing the introduction of a combination of landline, increasing cell phones, and increasing online surveys where they're trying to match the representative nature of our populace. There are some polls that are worth a lot in terms of the information they give you. For instance, I would trust a poll from, say, Siena College or Monmouth University, or anything put out by Fox News, because they have a Democrat and Republican pollster working together. Their polling is top notch. At the same time, I would also trust, believe it or not, I would trust the true internal polls that you see from campaigns, not the headlines they put out in the media, but the actual results, because campaigns are going to spend their money, especially ones that are serious, on good polling outfits that are trying to account for all of these different factors that have led to a reduction in response rates. The big thing when it comes to polling is you're going to be seeing a lot of polls, if you haven't already, between now and November about elections. You're going to be seeing a lot of polls about COVID. You're going to be seeing a lot of polls about Black Lives Matter. Look at the details of the poll, not so much the data, but the methodology. If they're not using appropriate methodology, if they're primarily doing, voiceless calls where they just basically have some like an automated voice telling you press 1 for this, press 2 for that, it doesn't mean it's a terrible poll, but it's not a gold standard poll. If you're not getting a mix of cell phone and landline and maybe even online, you're not getting a gold standard poll. Take those results with a grain of salt. We can still make decisions based off of polling. Campaigns do it, governments do it, various agencies do it, but you have to rely on multiple bits of information, and you have to make sure that the information you're getting is as good as you can possibly get it. And oftentimes that means paying extra for it. You get what you pay for.
So we're getting close to our end, but I wanted to ask about the upcoming election. And Richard Harkey has a question on what do you think Trump needs to do to be successful this election? And a similar question about Biden. What does he need to do in order to be successful this upcoming election?
I've always wanted to be a presidential strategist, so here we go. All right. So first with Trump, first of all, I believe that Donald Trump can win the election of 2020. I think it would be crazy to completely rule him out. There's still 4 months to go. There are certain things. We've seen some really major events happen over the last few months. Think about it. We're talking about COVID and we're talking about race protests. We're not talking about impeachment. That's like 5 years ago, seemingly, right? So a lot can still happen. In order for Trump to win, there needs to be a couple of things to happen. First and foremost, I mentioned earlier that his approval rating is a good gauge as to where he's going to be. If he gets his approval rating above 45%, and he's been around that level before, if he gets it around 45, 46%, that's one big step toward him getting closer to winning re-election. The second thing he needs to do is to make sure that people that would be that 46 to 50% of approval, right? Maybe he doesn't get there, but there are people that are willing to vote for him if he makes the right case. What does that case look like? Well, the economy, if it recovers, if we see that V-shaped recovery that people have talked about, and we see that people go ahead and even with COVID and the potential for getting it in the risks, they're contributing to the economy and it increases, then that's a message that they can get out there. Even if Trump doesn't talk about it, believe me, people are seeing the digital ads. They're talking to people. They can see if the economy is getting better and how much better it's getting based on, I can tell just by traffic when I drive from the east side to the west side. I mean, it's like, in April, there's no one out there at rush hour. Now there's more people. The other thing that I would recommend that Trump do is completely tear down Biden. There are some elections where strategically you have to run not only on what you've done, but on making your opponent look to be as bad as possible. I don't think Trump can win unless he basically goes nuclear on Joe Biden. There's ammunition there. There's always ammunition. There are always going to be people on the Democratic side that are going to be soft Biden voters. They aren't going to vote for Trump, but if Biden's too bad for them, they won't vote at all. That's one reason why Trump was able to beat Hillary. So he has to basically take Biden's numbers and drop them down. I don't know where Biden's favorables are at. I know that he's underwater. Trump would have to drive that down even lower. So those are the two things that Trump would have to do, in my mind, to win. For Biden, it is make Trump the story day in and day out. One thing we saw in 2016 was that whoever was kind of dominating the press coverage was doing worse in the polls. So as Hillary and emails and FBI and this and that became the story, she did a little bit worse. Trump does a little bit better. As soon as Trump flips the script and something comes out or he says something that he dominates, then his numbers drop. Hillary Clinton's goes up. So for Biden, it's all about making sure that we have, on the Biden campaign, that Trump is the story day in and day out. If I'm Biden, I'm happy with where things are right now because I sit in my basement and I don't have to do much. Everything is scripted. It's right in front of me. If I mess up, we do a second take. Great. Front porch campaign, William McKinley, Garfield, some of the great Ohioans of the past. Channel that. Now, that's only going to last for so long, but the longer that lasts, the more ground Trump has to make up. So keep moving on that way. Also, for Biden, I don't know if the VP pick is really going to make that much of a difference when all is said and done, but make sure that he is making continued inroads to not only the African-American community, which he did a great job of in the primary, but also the Latino community, where he struggled a little bit with Latinos. But Bernie Sanders did very well, especially I think in like Nevada and some other places, with Latino voters. So make those inroads with minority voters, find the messages that are going to work, remind them of why they are predominantly Democratic in the first place, and then finally have a strategy that is focused not on running up the score like Hillary Clinton thought she could do, but focus on a strategy that makes sure that you get to 270. That's the goal. Honestly, if I'm a strategist, I don't care if you get 305 electoral votes. I don't care if you go all Reagan on Mondale and 84 electoral votes. You need to get to 270. That's what you need to focus on.
Great. Thank you, Colin. We're approaching the end, but Colin's been gracious enough to agree to answer questions that we haven't had a chance to get to. So my colleagues have been taking down the questions and we'll give them to Colin, and then we'll go ahead and post them on our event website. And we'll make sure you have a link to that as well. I did have one final question, though. I think it's probably important for everyone. Where should people go to get information about politics? Not unbiased, because we know that everyone has their own personal biases. But what's the most reliable places that you go to for your political information?
Yeah, so I go to a lot of places. Look, there are some days where I completely turned off from politics and I don't want anything to do with it. I'll admit that. But most days I'm probably spending 3-4 hours reading stuff. And it's not simply news articles, it's also thought pieces. So places that I go that I like to see. First of all, I'm on Twitter all the time. I'm not tweeting constantly. So if you follow me on Twitter, you're not getting a lot of entertainment, trust me. But I'm following journalists. I'm following certain elected officials. And I'm seeing what they're reading and what they're putting out there. So pick journalists that you think do a good job. I will say that there are journalists on the Washington Post, on New York Times, the New York Post, the Washington Examiner, you name it. There are good journalists in Republican or conservative and liberal media sources. Second, I like to go to Real Clear Politics probably twice a day, once in the morning. They do an afternoon update. And you're going to know pretty much which side of the aisle a particular article is going to be on. But they're giving those articles because people are either talking about them a lot or they're well done. So it's a good place to go to read what's interesting to you and read people that you disagree with. There are some people that I genuinely like to read. I like to read. I'm trying to think of like specific authors. Drawing a blank all of a sudden. I think it's Connor Fryersdorf. I think he's at the Atlantic. Anytime I see his pieces, I don't always read them, but I, usually like bookmark them or I'll try to read them. There are, I think, some really good people over at the Dispatch, which is kind of like a conservative offshoot from the Weekly Standard. They'll do podcasts where they bring in people like Van Jones, who worked in the Obama administration. They do a good job of kind of having a nice discussion that gets both sides of an issue, or multiple sides, I should say, of an issue, because there's more than two. David Axelrod, who's a former Obama strategist, he does a really good podcast. I don't listen to him enough. 538.com, their podcasts, their articles, especially as it relates to data, I think are really strong and fairly even keeled. Let's see. I mean, I'll stick with those. I mean, if you want to, you can go follow me on Twitter or look at who I follow on Twitter and see like just the general people that I have. So that gives, I think, a nice mix of conservative and liberal. And, you know, I follow people on Twitter who are flamethrowers, and I follow people who are even keeled. I like to see what people are saying and what goes on there. So read a variety of things, listen to a variety of things, because I know a lot of you probably commute and, you know, you got podcasts and things like that. So those are some places that I go. Trust me, you don't have to spend 3 to 4 hours a day doing it like I do to be informed. I'm probably too informed. So there's that. Yeah.
So I guess a quick follow-up. What is your Twitter handle for those who want to follow you?
Great question. Let me pull it up because, you know, I tweet so often, right? So I am at, let's see. It's easier to type out. Can I put it in the
Want to put it in chat? Yeah, go ahead and put it in chat.
I just put it in there. So it's at CMOATCTOWN. So CMO at C-Town, that's a whole nother story. But that's my Twitter handle. So if you want to check out, again, you don't have to follow me. I don't retweet. I don't tweet out a whole lot of original stuff. But if you want to see who I follow, go ahead. I mean, you know, I have some friends that I follow, but a lot of it's political and sports. So,
great.
You know, that'll mix well.
Well, Colin, thank you again so much for being here with us this evening. We really appreciate your expertise. You've always been incredibly gracious to engage with our alums, and we appreciate your willingness to share your thoughts on this ever-changing political landscape that we live in. John Carroll University and our alumni community is truly fortunate to have you as a member of our community and educating our next generation of Blue Streak alumni. Before we conclude, I want to share with you all a few other opportunities that you can take advantage of. We wrap up our summer session of A.C.E.S on Tuesday, July 21st at 8 p.m. as we focus on the role of the media in today's society. The program will feature JSU professors Peggy Finucane from the class of 1980, and Professor Brent Brosman, and journalist Andrew Rafferty from the class of 2009. We're still also figuring out our fall term programming. However, we are excited to announce that we'll have programs focusing on the future of space exploration, the role the monuments play in our society, myths and stories of constellations, and the beer and brewing industry, just to name a few. Details will be shared on our website when they're available. And finally, as an offshoot of our A.C.E.S program, on Monday, July 13th, we're launching JSU Junior, a program for kids. This week-long enrichment program is geared toward the youngest members of our Blue Streak family, the children of our alumni, faculty, staff, and friends. All are invited to learn about space exploration, science, poetry, animals, and baking favorite recipes from the kitchen. We also intend to open this program up to the greater Cleveland community and surrounding school systems, exposing children throughout Northeast Ohio to John Carroll. As a reminder, registration for all these JCU programs is free. If you're interested, you can visit jcu.edu/alumni or follow us on social media at JCU Alumni for more details. Thank you again for being here tonight. Be well, stay safe, and have a wonderful summer.